The goal of scaling and root planing is to eliminate the source of periodontal infection. When you have active periodontal disease, routine cleanings are not enough because they generally focus on the areas of the tooth that are above the gum line. A scaling and root planing procedure removes plaque, tartar, and bacterial toxins from the surfaces below the gum line. To keep you comfortable, we usually numb the area before the procedure begins. Then, using instruments like these, we carefully and meticulously remove the plaque and tartar, and then smooth the root surfaces. Depending on your situation, we may also apply fluoride or a medication to the area. If you have just a few pockets of infection, we may treat just those teeth. But if the infection is more widespread, we may treat 1 or 2 quadrants of your mouth at a time, spacing the treatment over several appointments. Scaling and root planing removes the source of infection, helps your gums heal and tighten around the teeth, and gives you back your healthy smile.